Welcome to COVID's Lasting Impact, Caring for Immigrant, Migrant, and Asylee Patients, a 10-episode mini-series within Migrant Clinician Network's On the Move podcast, a podcast dedicated to providers who work with vulnerable populations, specifically migrant populations. In this mini-series, MCN provides clinical teams, including community healthcare workers and primary care clinicians, with up-to-date information, expert guidance, resources, and relatable case stories for identifying, treating, and managing COVID and long COVID among U.S.-based immigrant, migrant, asylee, and limited English proficient patients in the outpatient setting. MCN is a national nonprofit with extensive experience providing timely, practical solutions at the intersection of vulnerability, migration, and health. Each episode provides clinicians with impactful tools and information for improving the quality of COVID care for vulnerable populations. If you want to hear future conversations on the topic of health justice, be sure to subscribe to the On the Move podcast. For resources mentioned in today's podcast, be sure to click on the link in our episode notes to go to our podcast page at migrantclinician.org/podcasts.
I'd like to welcome you to MCN's podcast. The title is The Evolution of COVID-19, Moving Treatment to the Primary Care Setting. I'm Dr. Ed Zorowiecki. I'm the founding medical director of the Migrant Clinicians Network, and I'm very pleased today to have a co-host for this episode with me. Dr. Elena Rios is the president and CEO of the National Hispanic Medical Association and president of the National Hispanic Health Foundation. Welcome, Dr. Rios.
Thank you, Dr. Zorowiecki. It's a pleasure to be here with the Migrant Clinicians Network today.
All right. If you won't mind, if you would please introduce our speaker today.
Sure. So with us today, as we cover the topic of the treatment of COVID-19 being moved towards the primary care setting, is Dr. Trinidad Solis. Dr. Solis is a deputy health officer at the Fresno County Department of Public Health in Central California. Her duties include guiding the county's response to disease outbreak and assisting with health programs that promote chronic disease prevention. She also coordinates the health department's Rural Mobile Health Program, which aims to make healthcare access more equitable for people living in Fresno County's rural areas and for the region's farm workers. Dr. Solis is the proud daughter of Mexican immigrant farm workers with roots in the San Joaquin Valley of California. She previously worked as a family medicine physician in Los Angeles for several years, where she treated a diverse patient population. When the COVID-19 pandemic began, Dr. Solis wanted to help the region where she was raised and moved back to the Central Valley to assist with local efforts directed at mitigating the impact of COVID-19 on vulnerable communities. Dr. Solis received her undergraduate degree from Stanford University, yay Stanford, and earned her medical degree from the University of California, San Francisco School of Medicine. She completed her family medicine residency at UCLA Medical Center and obtained her Master of Public Health degree from Johns Hopkins University. Dr. Solis, welcome. And Dr. Zorowiecki, I know you're going to also
welcome, Dr. Solis. And I would like to have you take the opportunity now to say a few words of greeting to our podcast audience.
Yes, well, I want to thank you, Dr. Zorowiecki and the Migrant Clinicians Network for inviting me. It's really a pleasure for me to be here with all of you today.
That's great. Well, if you wouldn't mind starting out by just giving us kind of a snapshot of a day in the life of you working as a health officer at the Fresno County Public Health as related to COVID-19.
So yes, I joined our health department in 2020, right at the beginning of the pandemic. And my duties at that time included, for example, creating health advisories for our providers in the region, updating them on the latest with COVID, not only the COVID variants, but then eventually when the vaccines came out. I'm also, I assist with outbreaks. So when there was happening at different facilities, providing guidance. And I also helped initiate vaccination events at agricultural workplaces. And we were one of the first counties in the country to really start doing that, where we brought the vaccines to where farm workers were working at. And we found, because of our efforts, we were able to administer over 35,000 doses of the COVID vaccine to farm workers. And currently in my duties now, a few years later after the pandemic, as you mentioned, my duties still include creating health advisories, but it's not only on COVID, it's on other infectious diseases that might be occurring in the community, also promoting eating healthy, exercising, and also as well, like other outbreaks that may occur, I provide guidance, and I'm running the Rural Mobile Health Program, as Dr. Rios mentioned, where we're meeting the community where we're at, and now besides offering the COVID vaccines, we're offering other services such as diabetes screening, blood pressure checks, and other screenings such as those.
That's great. That's great. Well, Dr. Rios and I have some other questions we'd like to ask you. So I'll let Dr. Rios start out with this questioning.
Sure. The first question we have is, what are some of the outpatient therapies and treatments for COVID-19 now that primary care clinicians should know about?
Yes, and so before I begin, I do want to clarify that I do not have any potential conflicts of interest with any of the medications that I will be discussing. And these treatments that I'm going to be talking about are really based off evidence-based guidelines that the National Institutes of Health, or NIH, provides for clinicians. And so in regards to treatments, really, the NIH, based off the effectiveness of the treatments, ranks the current treatments that are available for individuals. And the first one on that list, it's an oral antiviral known as Paxlovid. And this medication is close to 90% effective at preventing hospitalizations and death. And what I really want to stress for providers is that these medications, the oral antiviral Paxlovid, and also the second one, oral antiviral, is molnupiravir, is that these medications are very good for individuals who are considered high risk. So for any clinician, when they see a patient in their clinics who are symptomatic, have COVID symptoms, and they're high risk, which means older age. So the CDC considers anyone over 50 years old as older age. And the studies show the older you get, such individuals are at higher risk of having to be hospitalized or other severe outcomes due to getting infected with COVID. Also having chronic diseases. As a primary care doctor, I see a lot of patients who have diabetes, very common in the Hispanic community and other communities of color, high blood pressure, asthma. I know at this time, there's a lot of parts in the country where there's bad smoke, air pollution, and that can contribute to worsening of asthma. And then if you get COVID on top of that, puts you at high risk. So again, if any of these patients come into your clinic are high risk, as a primary care provider, I think it's good to have that discussion with your patients, because a common barrier I see is that individuals don't even know that these treatments exist. A barrier for some providers with Paxlovid that I hear from when I speak with providers in my region is that they're concerned about drug-drug interactions, and they're worried, well, I'm not sure, can my patient take this? So I do want to highlight that there are drug-drug interaction tools available online. You can check with your local health departments, because we don't want that to be a barrier for our providers to at least have that discussion with their patients and prescribe such treatments.
Yeah, I have a second question for you. Since you mentioned that you've worked with migrant farm workers in the past, my question is, what are some of the possible negative impacts of the treatment changing to the primary care setting for those vulnerable communities such as migrant farm workers, immigrants, and asylum patients?
Yes. Well, from what I've seen with farm worker population out here in the Central Valley, is that many patients, such as the farm workers, have issues with access to care. So either they don't have health insurance, or in our region, there's a doctor shortage. So it can, even if you do have health insurance, it could take a while to get an appointment with your primary care doctor. And with these treatments that we're talking about today, it's really critical once a patient has COVID symptoms and they're testing positive and they're high risk, that they get treatment within 5 days of getting these symptoms. So that could be a barrier, Dr. Zorowiecki, in that if someone wants access to these treatments, and now that it's mainly in the outpatient setting, it can be difficult to access them. But there are solutions. I do want to stress that, for example, in our county, now that the COVID emergency has ended, we saw a lot of COVID test to treat sites being scaled down, not only here, but throughout the country. And so because of that, we have this rural mobile health program where, again, we're meeting the farm workers where they're at. We're not only doing COVID vaccines, but also testing them if they have symptoms for COVID, treating them right then and there. So that is one way we've developed a safety net, even though the COVID emergency has ended. And we are sharing these lessons with other counties. We've gotten inquiries from other local and state health departments asking about this program. So I do feel utilizing mobile health services is one way to bridge that gap. And also the telemedicine, what we've seen during the pandemic, telemedicine is another way to reach these vulnerable communities that may take a while to get a clinic appointment. And, you know, a lot of our patients nowadays have a phone. And so even in our rural areas, so the county where I work in here in Fresno County is a mixture of metropolitan and rural. And so for some of my patients, it's difficult to make it to a clinic where, you know, if it's in the metropolitan area and they don't have a car and transportation issues. But with telemedicine, we are able to bridge some of those gaps.
Sure.
So I have another question, and this is I'm going to make it a little different than what we've talked about. You already mentioned asthma as one way to triage your patients to know that they're going to have more risk for COVID-19 or higher risk. What other types of patients would you recommend to clinicians to help prevent COVID infections? And I'm thinking you've already mentioned farm workers. What about perhaps other vulnerable communities that you see, and what are solutions for them? And I'm thinking perhaps Spanish speaking, needing interpreters or services, or perhaps those with other chronic diseases that you've seen in Fresno.
Yes, that's a great question. And so in my specialty as a primary care family medicine doctor, we deal with a lot of chronic diseases. And so I've seen a lot of patients who have diabetes. So even having diabetes, that can affect an individual's immune system if it's poorly controlled. So that also places individuals at risk. The CDC also lists people who have heart disease, and they also know high blood pressure. So again, another disease where a lot of individuals have high blood pressure and they don't necessarily know that puts them at higher risk. So as clinicians, I think it's important, again, when someone comes in your office and they have COVID symptoms, they're testing positive, or if they're calling through a telemedicine appointment, it's good to look at their problem list, or if they're a new patient to you, ask, as you were saying, Dr. was asking about if the heart disease or diabetes, asthma, even obesity. In my county, unfortunately, there's high levels of obesity, and that can also increase one's risk of having issues of being hospitalized or dying. And you mentioned other communities such as Spanish speaking. And so in my county, there's a lot of Spanish speakers, especially, as I mentioned, with our farm workers, also monolingual Spanish speakers. And so I think utilizing, for example, in a clinic setting, having translation services as well to explain if the doctor is not bilingual. That way they can assist with explaining. Out in the community, from a public health standpoint, we utilize community-based organizations where we have community health workers that also come and educate the public about, hey, what to do. Have a plan if you have COVID. Talk to your doctor. And also, we noted that a lot of farm workers not only speak Spanish, but they also speak indigenous languages. And so that was a learning lesson for us to not assume if they're monolingual that it's Spanish, it could be indigenous. So we do have a community-based organization that speaks indigenous languages, and they also do outreach and help us out. So I think that's a great question. So in the clinical setting, using translation services, as you mentioned, but also out in the public health, we also work with our community health workers, also known as promotoras.
That's great. So you've given us some information about treatment for clinicians, but where can other healthcare clinicians turn to for additional guidance if they have questions about COVID treatments? And where can they find educational resources about COVID treatments for their patients?
Yeah, so I'm going to share some resources that I find really helpful and that I consider evidence-based. So I've reference the NIH. So the NIH has a section about COVID treatments, and they list it based off the order of efficacy. And as we know with COVID, the virus is constantly changing. Earlier on in the pandemic, there was monoclonal antibodies, and we were talking about them. And unfortunately, due to resistance and the virus changes, those are no longer listed. And so that is something I would like to share with our providers that I have found useful. So that's the NIH. Also the CDC, there's a section for healthcare providers that talks about not only the COVID treatments, possible side effects, and also, as I mentioned, drug interactions, what to look out for. Those are two good resources that I look for. And finally, I just want to say, our medical providers can also turn to their local health departments. We get a lot of, for example, from my perspective, I see a lot of emails coming through from providers having questions. Sometimes it's medical ones about COVID treatments. And just know you can always reach out to your local providers at the health department, or even state health departments have a team that can answer questions. So hopefully that gives our medical providers that are listening to this podcast some resources to turn to, and know that I don't want that to be a barrier about starting someone on an COVID antiviral. If they're not sure, there's resources out there to guide them.
Yeah, and from the National Hispanic Medical Association, our website is nhmamd.org, and we do have Vaccinate for All is our campaign to increase information about vaccines for COVID-19. But we also started a new website that had been revised called hispanichealth.info. And like Dr. Solis mentioned, we have resources in English and Spanish for the provider and for the patient. And there are links to CDC, NIH too, but also links to others and other medical societies that have information. We've tried to collect information all in one place, hispanichealth.info. And then, of course, we have virtual briefings that we've had for the last 3 years. They've all been recorded, and those are on our YouTube for National Hispanic Medical Association.
That's great. And the Migrant Clinicians Network, just so you know, the resources for this episode, this podcast, including a recording of MCN's webinar with Dr. Solis that she presented on this topic, can be found through the link in the notes section of this podcast. So just in recap, Dr. Solis, you've given a great explanation of what we can do at the primary care level. And I think it's important that you've also mentioned how to do outreach to populations that oftentimes aren't coming into the primary care setting. And I really appreciate all the knowledge you've shared with us today, and I'd let Dr. Rios give any final comments also.
Well, I think, Dr. Solis, you've done a great job with also presenting a more holistic approach to our vulnerable populations like farm workers, or like you mentioned, Spanish speaking who are monolingual, or even indigenous language populations. And one of the things that you mentioned that I think providers don't think about is many people don't have insurance or don't have access. So we have to go beyond just expecting patients to come to us or come to the providers. We have to reach out to the community-based organizations as partners to let more people know how important it is to come in to see your doctor when you have symptoms of COVID-19, or to go to the local clinic or local emergency room. And I think that thinking about that as the responsibility of our providers that are in our rural areas, and certainly for the migrant clinicians, it's so important to realize that not every patient is just going to have the opportunity to just knock on your door and come in and make an appointment. So thank you for all the public health aspects that you brought into the primary care providers, portfolio of activities to do for our communities.
Thank you.
And Dr. Rios, I'd like to give you an opportunity now to promote anything you've got coming up on your agenda in the next few weeks to this podcast audience who may very much want to tune in to.
Sure, the National Hispanic Medical Association is very proud of being able to provide information to our providers across the country and to those that are in the rural areas too. We have an immunization monthly Twitter chat. And again, that's to talk about the importance of immunizations for our most vulnerable populations. That's August the 1st at 1 p.m. And we have our Vaccinate for All campaign briefing series, August 30th, and that's 7 p.m. And these are Eastern time. The webinar topic will be called Closing the Gap, Enhancing Routine Immunization Rates Among the Immunocompromised Latino Adults. And you can find those events on the event bar of our website, nhmamd.org.
All right.
Thank you.
Great. Well, I'd like to thank our audience for tuning into this podcast. And I'd like to particularly thank Dr. Solis for her input today, and give you any last final comments, Dr. Solis.
Yes, well, I really enjoyed speaking with the both of you about this very important topic. Right now, as Dr. Rios mentioned about immunocompromised, if there are any patients that come across your clinic that are immunocompromised, either via because they're taking certain medications or due to their condition, then it's important to also initiate treatment with them or have those discussions, and also work with their specialists. For example, there's some patients who may be taking medications for cancer, and sometimes the primary care doctor may need to reach out with their specialist because of those drug-drug interactions. So I wanted to reiterate the importance of collaboration between a primary care doctor and a specialist if that's needed. But I think overall, it's just very important as a primary care doctor to have these discussions with our patients who are considered high risk, because we are at a point with COVID where we have these great tools available for us, not only the vaccines to prevent the severe illness, but also the treatment to also prevent hospitalization. So I think that's just a really big takeaway, Dr. Zero-Westy, that I wanted to share with our providers.
Okay, great. And I really want to thank Dr. Rios for taking time out of your very busy schedule to co-host this podcast with us and give you any final comments.
Well, thank you to the Migrant Clinicians Network for having us, and Dr. Zero-Westy especially. I think this is a collaboration that we need to continue. We have so many things in common with our providers who take care of the most vulnerable in our country. And I want to tell everybody, don't burn out, please, and don't retire. We need you. Dr. Zero-Westy, that's for you too. And Dr. Solis, who's a lot younger than us, but we definitely need more doctors.
That's great. Well, I just want to tell our listeners that they can find our guest online. You can reach Dr. Solis on Instagram at dr.trinidad.solis, S-O-L-I-S, and on LinkedIn by searching for Trinidad Solis, MD, MPH, and Dr. Rios and others from the National Hispanic Medical Association can be reached through Twitter and Instagram using the handle at NHMAMD. And for more information about the National Hispanic Medical Association, you can visit their website, www.nhmamd.org. And these links will be listed on our episode notes. So thank you very much for all these expert guidance and tools to improve the quality in COVID care for vulnerable populations. follow our podcast On the Move with MCN, and come back and listen again. Thank you.
Thank
you.
To access resources mentioned in today's podcast, click on the link in our notes section to go to our podcast page at migrantclinician.org/podcasts. Visit migrantclinician.org/sign up to join our email list and subscribe to our blog to get updates on new MCN podcasts, resources, and webinars. Migrant Clinicians Network is a national nonprofit dedicated to providing practical solutions at the intersection of vulnerability, migration, and health. We offer technical assistance, health provider capacity building, resource development, research and data and evaluation support, and virtual case management for mobile populations, and free resources and training. The information in this podcast is for trained healthcare professional education only. Information should only be used in combination with up-to-date national and international guidelines. The information is not to be used as healthcare advice for the general public.